Sociology of health. In this presentation, I am going to be covering the different concepts of health, including the negative, positive, and holistic concepts and approaches to health and illness, and outline the biomedical, sociological, and holistic models of treating health and illness and how these models can be put into practice. I will explain how health and illness are socially constructed, for example through social forces such as the media, government and health services and celebrity cultures, considering the concept of iatrogenesis, the use of language around health and illness, and how health is affected by social factors such as stigmas, culture, behaviour and socio-economic status. I will also identify alternative approaches to health and explain their implications for healthcare practice. I will be given examples of complementary and alternative medicine, explaining why and how these are used in the different approaches to health, their physical benefits and psychological effects, as well as their advantages and criticisms. So what are the different concepts of health? The negative. Individuals believe they have a good state of health as there is nothing physically wrong with them. They have no physical illness, no injuries, and are not suffering from any disease and are free from pain and discomfort. They see not having to visit the doctors for any reason, as they are in good health and do little to maintain or change their health. The positive. Individuals achieve and maintain a healthy lifestyle by living an active life, making a difference to their health by keeping themselves proactive, physically fit and having good mental health. Feeling well mentally and physically is viewed as they are in good health. And the holistic. This concept looks at an individual and considers the whole body and mind. Factors such as physical health, so how well the body functions, intellectual health, being able to think effectively, and emotional, the ability to recognise and express and manage standard emotions. And social, the ability to form relationships. It looks at the reasons behind poor health by looking at the lifestyle of an individual, suggesting healthcare professionals can improve their effectiveness when looking at the whole person. So what are the models for treating ill health? There's biomedical, sociological and holistic. Biomedical focuses on the physical or biomedical aspects of disease and illness. It is practiced by healthcare professionals and is associated with diagnosis, cure and treatment of disease, and patients are then given clinical diagnosis and treatment. Social model considers other factors which contribute to health around an individual, such as social economics, the environmental determinants, cultural, political, wealth and poverty, whilst also considering prevention. It can be practiced by a wide range of people. And the holistic model. This educates individuals on lifestyle changes and self-care to promote wellness and good health, including things such as good diet, exercise, and psychotherapy, whilst also offering complementary and alternative therapies and treatments such as massage therapy, yoga, reflexology, and herbal medicine. It can be practiced by anyone who chooses to do so. So how are health and illness socially constructed? Health is not always 100% a result of an individual's choice, but can be constructed and affected by society, and illness itself exists objectively. Different determinants will impact on a person's health, for example, education on healthcare, the media, different cultures, religion, family and peer groups, and social factors. Who decides what is good health and ill health? Illness can be biological and out of our control, but everyone perceives and interprets what being healthy is differently. Society's attitudes and views to health and illness define and give health and illness meanings. Cultural ideas and traditions of what is normal and not normal means people will see health and ill health differently and will define how a person experiences and treats an illness. For example, the COVID-19 vaccination has proven there is hesitancy from ethnic minorities to accept the vaccination. Research by Queen's Mary University 2021 suggests only 39% of BAME Londoners are likely to take the vaccine. This compared with 70% of white Londoners. Another poll by the Royal Society for Public Health, conducted at national level, found these numbers were 57% for BAME people and 79% for white people in the UK. Education, money, class, access to services, the environment, living conditions and support, as well as many others, all work hand in hand, and these social inequalities will affect an individual's health differently. For example, someone with a poor or lack of education may go into a poorly paid job, may only be able to afford the bare necessities in life, and be forced to live in poor living conditions, leading to ill health and lower life expectancy. Whereas someone born into a high class or middle class family may be able to afford private education and private healthcare and enable them to live a luxurious lifestyle, affording the finer things in life. For example, nice holidays, healthy foods, and gym memberships to keep them physically healthy, leaving them in a better state mentally and physically. Different cultures and ethnicities will affect an individual's health too, as there will be different environments, different opportunities, and different beliefs that stigmatise what health and ill health is. Statistics show that there are obvious differences in health and illness across societies. These graphs show that if neighbourhood areas within England are ranked from the most to least deprived and then organised into 10 groups, life expectancy increases in each group as the level of deprivation decreases. These graphs indicate how life expectancy varies with deprivation. Between the most and least deprived areas of England, the level of inequality in life expectancy is 9.3 years for males and 7.3 years for female. So what is considered as illness, disease, or as healthy has changed over time. Health and illness was once very much biological, but sociologists over time have established that illness and the spread of disease is influenced by the socioeconomic status of individuals, and that by looking at external reasons for illness and disease, it will help understand morbidity and mortality rates in society. By having an understanding on the social impact of health, it helps to understand and treat illness, changing the way some illnesses are stigmatised. For example, ADHD, dyslexia, and OCD are now recognised as illnesses and conditions. Postmodernists believe that social theories are constructed and deconstructed over time. Medical knowledge is also socially constructed. Society is given medical knowledge from science advisors, doctors, healthcare professionals, and chief medical officers. We use their information to understand illness, health, and medications. These professionals have authority and power as they are experts and have scientific and medical knowledge that a patient does not. As a society, we listen to what they have to say and believe they have the knowledge of what is good for us and what we should be doing to keep ourselves in good health. But is this a good thing? Looking at the Marxist theory and approach to health and illness, it suggests society is divided into two social groups, and we should question the motives of doctors, as they are there to serve the rich people of society, serving the interests of the capitalist state. As we find ourselves needing to seek medical advice and sometimes needing medication, huge power and profit is made for the pharmaceutical companies, supply manufacturers, and insurance companies. Knowing this and how many different medical diagnoses there are given to different individuals, how many of these are iatrogenesis and cause even more harm and ill health? Many medications and treatments have many side effects, and it can affect someone's health negatively. Globally, 4 in 10 patients are harmed by iatrogenesis, including diagnosis, intervention, error, or negligence, with 80% of them being preventable. As we keep up to date with the COVID-19 problems and watch meetings and conferences from the government through the news or on social media, We see and hear language that makes us feel confident that together we are moving forward, and it encourages us that we are doing via lockdown or face coverings and having the vaccine, that it's making a positive difference and having positive effects. This links with functionalist theory as it helps keep society in order by sharing the same norms and values. We see celebrities on television, on social media, and a lot of other places we look at society. And a lot of these celebrities are doing either keep fit weight loss plans, keep fit DVDs, showing off their physically fit bodies. This affects an individual's health, also whether it be positive or negative. Some people might see it to improve their health and take a positive approach to change how they treat their own health and get results, but then on the other hand, some people can see it could mentally affect them in a negative way, as they could feel that that's how they should be looking to be accepted in society. Whereas although someone may look physically healthy, this does not mean that they are healthy in other ways, for example, mentally. What we see and hear from famous, well-known faces through social media and on the TV has a massive effect and influence on our health. CAM therapies are used alongside traditional medical treatments, and alternative therapies are being used instead of traditional medicine. There are traditional, biomedical, and CAM approaches. These are traditional, biomedical, and CAM approaches. Some complementary therapies and treatments include listening and talking therapies, acupuncture, energy therapies, art, music, and animal therapies, yoga and meditation, body, touch, and massage therapy. So why are they used? Primary prevention. This aims to prevent and reduce the incidence of disease and illness. For example, ginger and acupuncture is used to reduce morning sickness, or hypnotherapy to help someone quit smoking. This will reduce the cost of treating disease later. Secondary prevention detects and treats illness at pre-symptomatic stages. For example, cervical smears, breast screening. This increases life expectancy and reduces costs to the NHS in the long run. And territory prevention. This aims to reduce the incidence and impact of chronic illness and injury by helping people to return to their everyday lives through therapies and rehabilitation, for example, counselling and diabetes management. These effective preventions will make a healthier nation whilst also saving the NHS a lot of money. Research shows some reasons for using CAM therapies include that they fit with individuals' values and choices, they reduce symptoms, it gives individuals a more active role towards treatment and recovery, non-toxic and natural, they help patients feel positive, increasing sense of health and well-being, and it's believed that it improves the immune system. These therapies are seen to help and to be effective today in society with the current pandemic. Many of these will be being used by people struggling with mental health, perhaps being able to use speaking and listening therapies, meditation, and yoga, for example. A lot of people won't want to be going to medical practices and would prefer alternative ways to treat themselves from their own homes. CAM therapies are popular with patients dealing with cancer. Many complementary therapies concentrate on relaxation and reducing stress. They may help to calm your emotions, relieve anxiety, and increase your general sense of health and well-being. Many doctors, cancer nurses, and researchers are interested in the idea that positive emotions can improve your health. For example, acupuncture can help you relieve sickness caused by some chemotherapy drugs, or it can help relieve a sore mouth after having treatment for head and neck cancer. Acupuncture can also help to relieve pain from surgery to remove lymph nodes in the neck. Doctors make many decisions about patients' treatments, and it can leave people feeling like they don't have much control over what is happening and can be left feeling alone and clueless. Complementary therapy lets them take a more active role in their treatment and recovery in partnership with their therapist. A good therapist can play a supportive role during cancer treatment and recovery. For example, a skilled and caring aromatherapist can take the time to make you feel cared for, and this might help improve your quality of life. Although a significant amount of research supports the safe and effective use of CAM for a number of CAM therapies, and medical professions do recognise the benefits, there are also safety concerns and criticisms too. The use of herbal supplements not backed by research or approval can be dangerous. People can experience harmful drug interactions or ingest toxic or contaminated ingredients. Controlled studies are difficult to facilitate. Manipulation of the body can increase the risk of harm. They may make conventional therapies and medications work less, increasing side effects. And there is no evidence that these treatments and medicines work to cure illness. Attitudes towards CAM therapies vary. The four main areas include biomedical perspective. This is resistance towards complementary and alternative therapies. Complementary therapies, which also work in with the holistic approach, where the body and the mind are addressed as being equally valid. The progressive perspective, use of both biomedical and CAM therapies are used, but they must have evidence to back them. Postmodern perspective, suspicious and skeptical of any knowledge about health and ill health that has been constructed by society or institutions, and it supports the individual's choice of treatment. A study from the National Library of Medicine 2010 shows the types of people that use CAM therapies. The data from 7,630 respondents shows individuals with lifetime and 12-month prevalence of CAM use were 44%, with 12.1 having consulted a practitioner in the preceding 12 months. Massage, aromatherapy, and acupuncture were the most commonly used therapies. 29% of the respondents taking prescription drugs had used CAM in the last 12 months. These include women, university-educated respondents, those suffering with anxiety or depression, people with poorer mental health, and lower levels of perceived social support, and people consuming more than 5 portions of fruit and veg a day. From this presentation, I have looked at the different concepts and models of health and how they each consider, treat, and affect health and illness, and how these all have their benefits and drawbacks. I have looked at how health and illness is socially constructed from several factors such as different cultures, ethnic backgrounds, social class, and attitudes of different individuals. It is clear that there are many inequalities in health and illness that can massively affect individuals' mental and physical health. And by looking at research, we can see it has been proven that living in the lower ranked, most deprived areas of society has had effects on those, and those living in those areas are more likely to have the lowest life expectancy. There are many influences on how health and illness are perceived, spoken about, and portrayed, and these all influence how society constructs health and illness. From the powerful head chief medical officer on the news talking about the current pandemic, using language that can be frightening yet uplifting and positive all in the same speech, makes us feel as a nation that we are reacting with the same norms and values towards the virus. To, on the other hand, celebrities in magazines we read with the perfect body affecting mental and physical health. All of these contribute to how society views health and ill health. And finally, looking at CAM therapies, it is clear that a lot of alternative approaches to prevent and treat illness, either alongside conventional medicine or instead of, we are able to see the benefits for individuals and for the healthcare practice. I have looked at how these therapies can be seen to help and in what way and for what kinds of people, but also spoken about what can be criticised for these approach. In conclusion, it is clear that there are many different approaches to explaining, treating, and viewing health and illness, from different angles, each working and each having their criticisms. And once you look deeper into the meaning and reasons behind health and illness, there can be many distinct aspects, approaches, and theories behind explanations. Thank you.